Welcome back to another episode of the Many Faces of Cancer podcast. I am your host, Melissa Grosboll, and joining me today is Tony Collier. Tony has been married to Tracy for nearly 45 years, has 2 children and 4 grandchildren who are a massive part of his post-diagnosis life. He's a consultant to Bennett Brooks Chartered Accountants who recently acquired the practice that he used to be managing partner of until his illness. Tony has been the provost, think unelected mayor, of his hometown Aldringham, and was awarded a British Empire Medal in the Queen's 2019 birthday honors, recognizing his work in the regeneration of Altrincham and charity fundraising for local charities. Tony was diagnosed with advanced state prostate cancer in 2017. He had a prostate-specific antigen score of 129, which below 4 is normal, and mets throughout his skeleton from pelvis to skull. He is an ambassador, awareness speaker, volunteer, and fundraiser for Prostate Cancer UK. He is also a trustee and vice chair of Tackle Prostate Cancer, who are responsible for supporting over 150 prostate cancer support groups across the UK. Tony is also an ambassador and regional champion for 5K Your Way, a peer-to-peer support group encouraging those living with and beyond cancer to exercise, and part of the Move Against Cancer charity. Prior to his diagnosis, Tony was a good standard club runner training to take on one of the world's toughest ultra marathons. He's completed 20 marathons, including all 6 world marathon majors and 2 ultra marathons. He continues to run and achieve things that people without stage 4 prostate cancer would struggle to do. Tony literally went from training for an ultramarathon to terminally ill in 36 hours, and he will tell the very personal story of his diagnosis and the impact on his life. He will also talk about the risks of prostate cancer and what steps men need to take to ensure that they don't end up like him. Tony had no symptoms prior to his diagnosis at age 60 until a groin strain developed 3 months prior to his diagnosis. His urologist suggested that Tony had had the cancer for 10 years. A simple blood test and things could have been so much different. So welcome to the show, Tony.
Hi, that's quite an intro.
That is quite an intro. Thank you for sharing it all with me. I love when people write their own intros because then I don't have to come up with it myself.
No research needed. That's great.
So wow, Tony, do you still run today?
Yeah, I try to run 4 days a week. Unfortunately, I had a knee replacement in May 2024, and that sort of slowed me down a lot and set me back about 3 years. The cancer has never ever stopped me from running. And I've done some ridiculous things since my cancer diagnosis as a runner. So I'd qualified for the London Marathon in 2018, and I thought, a year into treatment, the treatment was quite savage. Shall I take the place? And I thought, you don't very often get a place for London, so I thought I'll take the London place, and I did. I ran a massive personal worst of 5 hours and 7 minutes. My normal bests were around 3:20. But I raised £13,000 for Prostate Cancer UK, and it was my 20th and last marathon, and it's the one I'm most proud of. And then I went and did another 100-kilometre ultramarathon over 2 days, 36 miles on day 1, 28 miles on day 2, with an overnight camp stop. That was the worst night of my life. I'm never ever going near a tent ever again. I hate camping with a passion, and it was a one-man tent in the middle of a field, and it was so cold. So I completed that in 17 hours or something ridiculous. And and then I did. I ran 5 kilometres, at least 5 kilometres every day for 365 continuous days, raising money for the Move charity, which are behind 5K Your Way that you mentioned. And I raised over £22,000 for that charity, which supports teenagers and young adults living with cancer to get them moving again, because movement is really important. So I've kept pretty active, yeah.
Sounds that way. You know, and you and I are kindred spirits on this. I am such a huge advocate of exercise with cancer diagnosis and treatment and post-treatment, and how important it is to have a strong body. And, it leads to better mental health as well as physical health and all the things. So you and I are definitely on the same page on that.
Yeah, I think it's absolutely right. And I'm also in Greater Manchester in England. They have a preeminent prehabilitation program. It's world leading. And we actually put patients through prehabilitation before treatment to get them fitter for treatment, which gets them out of hospital quicker afterwards, gets them back to being economically viable more quickly, and saves our NHS an absolute fortune. And I'm one of the 2 patient reps on the steering group for that, and I've been involved now for 6 years, and developed a load of expertise in prehabilitation and rehabilitation. And I speak at 2 prehabilitation conferences every year as a patient, basically, just to guide people through involving patients in the process of setting up a prehabilitation scheme.
Imagine that, involving patients.
Yeah, imagine just that, involving patients. I think. Well, we have. How many things?
I will say that is something that the United States is sorely lacking, is
Is it?
that prehabilitation. And I had never even heard of anything like
There you
that
go.
before we talked. And that is just, oh my gosh, it is so needed here. And I don't know, maybe that's my next calling, is figuring out how to get that going here in the States.
Well, we're trying to get it basically as a standard of care across the whole of the cancer pathways in the UK. But it does cost, it does cost money. But we've proven it saves about £1,000 per patient that goes through the program, and the program costs about £400 a patient. So it's actually
Definitely
saving the
worth the
NHS
investment.
way more money than it's costing, and it makes so much sense. So yeah.
All right, well, Tony, take us back to 2017. Take us back to what was going on in your life when you got your diagnosis. And you said that you had a groin strain. So how did that kind of get you to your prostate cancer diagnosis?
Yeah, well, I'd run the Comrades Ultramarathon in 2016, which is 90 kilometres in South Africa, 6,500 feet of climbing, and usually around 30 degrees centigrade. So a real major challenge, and it was the highlight of my running life. And if you do 2 back-to-back back-to-back Comrades, they give you a special medal. And I thought, wow, I quite fancy another medal. So decided to enter again in 2017, and the race was due to be on the 6th of June. In the February, I experienced the groin pain for the first time, running down a hill at the start of a race, and I got this searing pain through my groin. Didn't think much about it, but it got progressively worse. And then I ran 2 marathons a week apart at the start of April 2017. And when I got back, I couldn't get my right leg out of the car. I was in so much pain. So I thought, well, I won't be running Comrades on the 6th of June unless I do something about it. So I made an appointment to see a sports injuries doctor, pre-arranged an MRI scan. He saw the scan, called me into his office and said, we're not seeing what we expected to see. Whilst you're here, go and have a blood test and a chest x-ray. And I'm going, I've got a groin strain. What do I need those for? It's just that I want to rule out anything untoward. But then when he said, and tomorrow I put you in for a full body CT scan, you can imagine the absolute terror. And I went for the CT scan Tuesday the 9th of May, etched on my mind forever. And at 8 o'clock in the evening, I'd been to my running club, and I was just leaving with my group of friends to go for a beer. And my mobile rang, and it was the sports injuries doctor, and he said, I'm really sorry to tell you, Tony, but I'm 99% certain you've got prostate cancer. And I'm going, what? And he said, well, I'm calling to tell you because you need some more urgent diagnostic tests, and I've got you booked in for those. But I was 15 minutes away from home, and I had to drive home in floods of tears to tell my wife I'd got cancer. And that was the hardest drive of my life, and one of the hardest things I've ever done in my life. And I made the fatal mistake of saying to her, I can't look after you anymore because I've got cancer and I'm going to die. Therefore, you need to go and find somebody else to look after you. and that's where
Oh
the
my gosh,
mind
this is your
goes.
wife? You said that to your
Yeah,
wife?
and that's where your mind goes, doesn't it? When you've just been given that horrendous news, and as you know yourself, and yeah, I mean, it was a major mistake. I got a clip round the ear for it, which was very justified. And ever since then, she's been an absolute rock. She's been by my side now for 8.5 years, and I couldn't live without her. She's an amazing woman, and she's our family rock as well. She looks after all of us, from grandchildren to her mother, and me in the middle. So yeah, she's everybody's carer. She's an amazing one. And I think, with cancer, I think our carers get very much neglected. Don't you think so? Think so?
Absolutely. Yes, I've interviewed several caregivers, and because I really want to have that be a part of this conversation
Yeah,
from a standpoint of they're the unsung heroes, but also to help cancer patients to understand
yeah,
what the caregivers go through. So, I mean, when we're in care, we tend to think that it's all about us. And, some of us can be demanding and stuff of our caregivers, and just to help people understand and help the patients understand, like, okay, these people they need their own self-care. They need to be able to have a break. And I love being able to share those stories, because it just wakes people up to, oh my gosh, like these people have a life too,
well, I think it's so important because it affects them just as much as it affects us, and
maybe
it affects
even
them
more.
really adversely. I mean, at the end of the day, my wife faces the prospect of losing me prematurely, although I am doing remarkably well at the moment. So, and incidentally, the groin strain turned out to be stress fractures of the pelvis, and it turned out that the cancer was in my pelvic bone. There was a massive cancer, and I don't know. Over the next 10 days, I had biopsies, bone scans, and then my wife and I went to see a urologist for the first time, and he confirmed it was cancer. And he said, and unfortunately it's advanced cancer, and it's not curable. So I'd heard the words cancer and then incurable in the same breath, and it was like, what? So it was the devastation of being told you've got cancer is nothing compared to being told you've got incurable cancer. And his next words were, and I guess you want to know how long you've got to live. And I'm going, I've got an ultramarathon in 3 weeks. What do you mean?
Time for cancer.
What do you mean? So, and then he told us 2 to 3 years, worst case scenario. He did go on to say the best case scenario, and we didn't hear the best case because you hear 2 to 3 years, and
Right.
and I just made the major mistake of, unfortunately, I lost the joy of living through the fear of dying, and the first 18 months I really suffered. Ended up having a breakdown, realised I needed some counselling. I realised it was a sign of strength to get counselling. And I would urge any cancer patient listening to the podcast, if you need help, you've got to ask for it, because it's not a sign of weakness, it's a sign of strength. And I got some counselling, and I cried on the shoulder of a caseworker for 2.5 hours, and then met a psychologist 4 times, and we talked all about mindfulness, and then I went home to practice it, and the phone rang, and that was the last time I did mindfulness. I got interrupted, and I thought, oh, no, I can't be bothered. but I did actually.
It's not for everybody.
I still had a busy life, and I thought, hey, I'm going to get interrupted every time I try to do something. So what I did do, though, is I learned techniques on how to bring myself back from the dark place, because your mind goes to that dark place.
Absolutely.
And I learned some techniques to bring myself back from that, which was primarily thinking about the great things in life, thinking about the things that you love, the things you really enjoy. And for me, it was mainly thinking about my grandson. I had one grandson back then. So just mainly thinking about being there for him and being there as long as possible for him. I had bone mets throughout my skeleton, literally from pelvis to skull. When I saw the scan, it was like, what on earth is that? And there were black clumps of cancer everywhere. And I had no symptoms. And my wife said to the urologist, how long do you think Tony's had this cancer developing? And he said, probably 10 years. I mean, can you believe that?
And I used to be a chiropractor. I'm a retired chiropractor, and I would talk to my patients all the time about health. And, back then I did not have cancer. I didn't even really know anybody with cancer, but I would say, health is not just the absence of symptoms. Like if you have a cancer growing inside of you for maybe up to 10 years, but you don't have any symptoms, does that mean you're healthy? Like just because you don't have any symptoms doesn't mean that there isn't possibly something going on. And now that I've gotten into that cancer realm, the truthfulness of what I used to talk about all the time has just become so much more evident, with cases like yours. Most people with metastatic cancer, like they don't know, and there are no symptoms until it's too late, unfortunately.
Yeah, and I think that's a big thing with prostate cancer. For early stage prostate cancer, it's usually symptomless.
Mhm.
And men do sometimes experience symptoms which are usually pee orientated.
Right.
They can't pee when they go to the toilet, they have urgency peeing, or when they do try to pee, it just dribbles out. Um, and that's typically a symptom of a prostate problem, not necessarily prostate cancer.
Mhm.
Um, and so you tend to think of that as being sort of age related as well. I'm getting older. I was
And for
60.
some it is.
You know, and I do think, unfortunately, for lots of men, the first time they get symptoms are when it's too late, when it's already spread outside the prostate. And because in the USA and in the UK, we don't have a screening program, so
I mean, you've
men
got the
don't.
PSA test. That's about
Yeah,
it.
that's it. And they don't screen with that because it's not prostate cancer specific and it's not sensitive enough. So they don't screen with that. It's just an indicator tool to start the process. But when my wife asked the urologist about how long he thought I'd had the cancer developing, and he said 10 years, I then found out I'd had a right to this PSA blood test, prostate specific antigen, from the age of 50 in the UK, and I didn't know about that. And so at the moment, early diagnosis relies on, first of all, you've got to be aware that you have a right to the test. Then you've got to ask a doctor, a GP, and quite often the GPs say, "Oh no, you've got no symptoms, go away," which is really stupid because it's an asymptomatic cancer.
Right.
And so it's a perfect storm. And I'm sure it's the same in the USA, but we are now seeing more and more men diagnosed in the UK at metastatic stage.
Mhm.
About 20% of men in the UK diagnosed with prostate cancer are metastatic at diagnosis, like I was. And
Wow.
the survival at 5 years is improved a little bit because of advances in treatment, but the average survival at 5 years is about 50%. So it's still not great.
And that's really a shame because we tend to think of, or at least we've been told, that prostate cancer most oftentimes is a very slow progressing cancer, and most men, by the time they're diagnosed, like they're going to die of something else before they die of the prostate cancer, and so it's a wait and see thing. I personally do not hear that much about incurable, advanced stage prostate cancer. I hear kind of from the other realm, so I tend to think, oh well, I mean, all cancer is a big deal,
Mm.
but men live with it, for years and years and years. So, and they're usually older men. Like you were diagnosed at age 60. That's
Yeah.
pretty young for prostate cancer, isn't it?
Yeah, and I think the big issue really is that you're absolutely correct. The indolent cancers that were never going to cause somebody harm because it was indolent, they were going to probably die of something else rather than the prostate cancer. There are those cases that, unfortunately, there are also cases like mine and Sir Chris Hoy's. Sir Chris Hoy was diagnosed at age 47.
Mm.
And being told that you're terminal at 47 when you've got two children who are less than 10
Yeah.
is horrendous. And so we desperately need a screening test, and we definitely need a screening program, but we're still being refused that in the UK. And we are campaigning very hard to try to get a screening program, but I don't think we'll see one anytime soon. I hope we see it in my lifetime.
Well, just keep living and hopefully you will. Yeah, I don't think we have much here in the US either.
No.
unfortunately.
No, and I think
Yeah.
the sort of screening issues started actually in the US with United States Special Task Force, which basically did a look into prostate cancer screening and decided it was causing more harm than good, because people were being diagnosed with indolent cancers that were never going to cause them a problem, but then having radical treatment that did cause them problems.
Gotcha.
But the diagnostic pathways improved significantly since those days. The problem is that a lot of the healthcare professionals haven't caught up, and that's a big issue. So we have a much better diagnostic pathway. That means men are not harmed as much as they used to be. Some men are still harmed. So some men, get told you've got cancer at the age of 65, but it's indolent, it's never going to cause you a problem, but you can't cope mentally with having cancer inside you. You're gonna ask for that prostate to be removed, which is major surgery, can cause incontinence, can cause impotence. That man's chosen to have surgery when he doesn't need it. And what we actually need now is healthcare professionals to persuade men in those circumstances that they definitely do not need surgery, and help
I was
them
going to
cope
say,
with
it sounds like there needs to be just more education. And I
it.
know that, you mentioned in your bio that you work with several different prostate cancer charities. Is that one of the things that they are working toward, is more education for men about don't necessarily go through that if you don't need to?
I think that's absolutely the case. Not only educating the men, but educating the healthcare professionals. Because at the end of the day, it's the healthcare professional that is acceding to the man's request to have a prostate removal. And what that healthcare professional should be doing is saying, actually, you really don't need this. And there is actually evidence now that says the outcome for a man going on to active surveillance is exactly the same outcome in 15 years' time as for a man who had a radical prostatectomy or radiotherapy. There are no worse outcomes from being on active surveillance. So what they need to do is the healthcare professionals need to explain to patients more clearly. So yeah, training is really important for training of patients and training of healthcare professionals. And Tackle Prostate Cancer that you mentioned, I'm a trustee of and vice chair. We have a program at the moment and it's called Make Sense of It. And what Makes Sense of It does, it mentors newly diagnosed men through the treatment decision pathway. So if they've got a low-grade indolent cancer, we'll be trying to persuade them that active surveillance is a very, very viable option and guiding them along that way. I mean, we're not giving medical advice, obviously, but we're talking to them about the pros and cons of their treatment decision so that they don't end up with treatment regret.
And now, how did you get into kind of this charity work? Was there kind of were you asked to speak, or were you just looking for help yourself and got more involved? And like, what was that progression for you?
It was a complete fluke. And as someone described me the other day as one of the leading patient advocates in the UK for prostate cancer, I was very flattered.
Wow.
I'm not sure whether that is the case, but I am very gobby, so loudmouth. So I do. I'm very vocal about where we are. So in the UK we have these centres called Maggie's centres, and Maggie was a woman who died of breast cancer, and she set up a cancer support centres right near big cancer hospitals. And so in Manchester we have the Christie, which is world famous, and 400 yards from the Christie is a Maggie Centre. And when my wife and I said to the oncologist this time, we are falling apart, we don't know where to go for mental support, what do you suggest? And he said, go to the Maggie Centre. So we went to the Maggie Centre, and it became a sort of safe haven for us after we'd been across the road for treatment or bad news or good news or whatever. But then I met this lady there called Margot, and she organises a fashion show every year. And the fashion show is to raise money for the Christie, for the Maggie Centre. And she said, "Oh, I've got a place for you on a catwalk. You're going to be a model in a fashion show." And I'm going, "Really? I've got 2 left feet, can't dance, can't move, can't walk properly. Yeah, you'll be fantastic. You'll be brilliant." So I ended up having a relationship with Margot that became more than just supporting Maggie's. She also had an involvement with the Manchester Airport fire crew because they were part of the fashion show. So she said, why don't you go to do some prostate cancer awareness talks for the firemen? So I did 4 prostate cancer awareness talks for each of the 4 watches at the fire station at the airport. And I thought, actually, I quite enjoy doing this. I wasn't great at it at the time. But then I contacted Prostate Cancer UK, which is the leading prostate cancer charity in the UK, and became an awareness speaker for them. But actually, the reason I contacted them wasn't about volunteering. It was a complete fluke. I fell into the volunteering, really. I wanted to make contact with a runner who'd been diagnosed with stage 4 prostate cancer because I wanted to find out what the impact on my running would be for my diagnosis. And they put me in touch with a remarkable man called Kevin Webber. Kevin, since his prostate cancer diagnosis at the age of 49, has run the Marathon des Arbres 4 times, which is a 6-day race across the Sahara Desert. And he did that in between chemo sort of thing, so the guy is amazing. And Kevin just persuaded me that first of all, I could do some great work for Prostate Cancer UK, which I have done, but also that I could do way more with my running than I thought I was capable of. So all those challenges I mentioned before, that was because of Kevin. So it's all flipping Kevin's fault. So yeah, I became an awareness speaker for Prostate Cancer UK, and then a lady called Sarah Gray, who runs Tackle, got to know about me, and there was a place for a trustee on the board, and she contacted me and said, do you fancy being a trustee? And I said, not really. And anyway, I got persuaded to be a trustee, and I've been a trustee for 3 years now, and we look after 150 support groups. They probably all have 100 members. So we are supporting a lot of men across the UK.
That's fantastic. And that's another thing that we talk about a lot is peer-to-peer support groups and, being around others who are going through things and how therapeutic and beneficial it can be to, just be able to share with people who've been there and who've done that, and how it can so much help your mental health by being around others who have gone through it. And, like Kevin, who, just helped to push you to be able to do more than you thought that you could do, which is just so amazing.
We've remained very good friends, and he's actually on the same treatment as me. And he's also doing remarkably well. We both have virtually undetectable PSAs. He's at 10 years, I'm at 8.5 years. So we've both done remarkably well. And he credits it with the running. He said, well, we're both runners, that's why we're doing so well. But unfortunately, I have lost friends who are runners to prostate cancer. So it's not just because we're runners, it's because we've done really well with treatment. So.
And so you are 8 years out now and virtually undetectable. Are you considered no evidence of disease, or what's your status right now?
If they did a scan, they would only see bony regrowths where the cancer was. Right. But the reason prostate cancer is incurable is because microscopic cells lie dormant in your body. Prostate cancer feeds on testosterone, male hormone, and these microscopic cells lie dormant and eventually find a way of living without testosterone to feed on. And that's why prostate cancer is incurable. So I'll never be cured, but if they did a scan, they wouldn't find any tumours because all these micro cancer cells are hidden and too small. Right. And what typically happens is as the cells become clever and find a way of growing again without testosterone, your PSA level starts rising. And that's the first signal that treatments are starting to fail. So I get tested every 12 weeks. I have treatment every 12 weeks, 2 treatments every 12 weeks. I have treatment every day. And you can imagine, you've been there, and people talk about scan anxiety, the anxiety caused by a scan. Mine's blood anxiety because I have a PSA blood test. So I call it blood anxiety. And you can imagine, when I first started doing these every 12 weeks, and like 3 weeks beforehand, my anxiety levels rose and rose and rose.
Wow.
And I gradually learned how to control that. And then it became 2 weeks, then 1 week. Now I'll think about it the day before. And so I tend not to get too anxious about it anymore. And that might be because I've been stable and my PSA is undetectable, and I've no idea how I'll respond when I get told that my PSA started to rise, because that means you're moving into a different phase of your pathway, and it's a phase from which there's no recovery. So you can imagine the anxiety every 12 weeks is not fun.
We're not gonna think about that. But
No.
so here you go. You had mentioned earlier that, mindfulness went away really quick.
Yeah.
But here you are. I mean, that is the definition of mindfulness, and being able to go from being anxious for 3 weeks to just being anxious the day before. So you're still practicing mindfulness. Absolutely.
Yeah, I mean, it's just different techniques, isn't it? It's not,
Absolutely.
lying on the floor connecting with the earth and then the phone rings, which is what happened when I tried it the first time. I'm lay on the floor, arms out, legs out, connecting with the earth, and then the telephone rang.
Yeah.
So,
Meditation and mindfulness come in all forms.
absolutely. Yeah,
I would think probably your running is a form of mindfulness. For me, I love to walk out in nature, and
yeah,
I can't sit and om for,
no,
10, 20 minutes, but I just go for walks out in nature. And for me, that is
yeah.
my version of meditation. So
The
it
same,
looks different for everybody.
yeah, the same for me. Lots of things, if I'm feeling a bit rubbish, some music always helps.
Mhm.
My wife and I are massive music fans, and we go to 2 live gigs a month. And we love country music. We go and see all the big American stars when they come to the UK. So we have this music festival that's in London, Belfast, and Glasgow every year. And it's a 3-day festival, and all the top acts from America come over and play in the UK. And that's in March this year. So we've been to London for the previous 9 years, but this year we're going to Glasgow for a change. But if I'm feeling a
You
bit
have
low,
country music over there?
yeah, country is massive over here. You wouldn't
Oh
believe
my
how
gosh.
big it is. I mean, we get everybody coming over. So we've seen Luke Combs several times. We've seen Morgan Wallen, and this time we've got Brooks and Dunn coming, and Keith Urban, and all these are massive names in America, and they're coming over to the UK, and it's like, this is great. So
I love that.
yeah, so music for me has been a type of meditation. It's my way of relaxing, and put some music on, go to a concert. There's nothing better in life than live music. I just love live
Absolutely.
music. Uh,
Absolutely.
and reading. I quite enjoy reading, although my powers of concentration are not what they used to be.
That's why I love audiobooks, because I can be doing other things and just listening to an audiobook, and
Good
that
thing.
way I don't have to try and sit down. It seems to me that if I try and sit down and read, I end up like dozing off
Yeah,
and trying to
yeah.
fall asleep. So,
It's an age thing, It's an age thing.
okay. Everything
We're
is an age thing. I
we're not
gotcha.
spring chickens. We're not spring chickens anymore, are we?
All right. So you said since your knee replacement, you have not been really able to run the way that you used to. So how are you, taking care of yourself, like exercise wise and holistically? You say you get treatment every day, you get treatment every 12 weeks, but from a more holistic side, what are you doing to take care of yourself to help keep this cancer at bay?
So I do still run. I mean, the knee replacement really slowed me down. I had 15 months of no weight bearing exercise, and
Oh
I
my
lost
gosh.
fitness really badly. And every time I come back and get close to where I think I could be, I've been hit by, because my immune system is really not great, because I'm on long-term steroids and they lower your immune system. So
Mhm.
every cold virus or flu virus that comes around hits me for 6. And it seems that every time I get back to what I think is reasonable for somebody with stage 4 cancer and a new knee as a runner, I get hit by something and get set back again. So it seems to be a constant battle at the moment. So I try to run 4 times a week. I do some strength work, because strength work is really, really important.
Especially without testosterone.
Yeah, especially without testosterone, 'cause you lose muscle mass and you lose bone density. And so the best thing you can do to try to stave that off is to do some strength work and some
Mhm.
cardiovascular work. I'll go out on a bike occasionally when the weather's nice, but I'm definitely a fair weather cyclist. I don't like going out when it's cold and wet and windy. I'm actually not that great. I was supposed to go for a run this morning, but it was really cold outside. I thought, no, I'm not going. So I wimped out big style. And like you, I quite enjoy walking. But I do find that one of the best things about my cancer diagnosis is my work as a patient advocate. And I've now, I think, become quite well regarded as a patient advocate. I work with four of the big pharmaceutical companies as a patient consultant on their patient panels. I've spoken at three international conferences in Hamburg, Berlin, and Paris, where I've spoken about the need for holistic care and and the fact that there is no holistic care, basically. Holistic care in the UK is awful. And the way I think of holistic care, it's looking after the person, not the cancer. And so
Yes.
it's things like mental health, psychosexual therapy, because that's non-existent in the UK. And when you have your testosterone removed and can't get an erection and you lose your libido, so you don't even think about sex, you can imagine the impact on that has on relationships. It's not great.
Absolutely. We didn't even get to that. That's a huge
Yeah, it's
piece.
a massive, and all those things are really difficult to cope with, and I do think that care is really poor. And so I've stood in front of a room full of urologists and a room full of oncologists and said, basically, you're rubbish at what you do. You're really good at treating the cancer, but you're not really good at looking after the person. And that for me is what true holistic care means. And I think it's a really simple thing to do. But the healthcare professionals don't have a lot of time. You may get a 10-minute consultation. They've got to get a lot of information in there. And then the healthcare systems are completely strained. And here in the UK, it's very difficult to even get GP appointments at the moment because they're so busy and there's so few of them. And so it's really challenging to get true holistic care. But I will carry on fighting for it for as long as I possibly can because I think it's really important. And I talked about psychosexual therapy because I think that's the area that's really sadly lacking. And I had private medical insurance when I was first diagnosed, and that meant that my wife and I could actually buy some psychosexual support. And that was really important. And it enabled us to maintain a loving sexual relationship, but a very different sexual relationship. And I think it should be standard of care that men or women with the hormonal cancers are given psychosexual therapy because it's really about intimacy. It's about men understanding that although they can't get an erection, they can still have an orgasm. And it's about learning different ways to please each other. And it's about the importance of a kiss and a cuddle and holding hands. And that for me is what psychosexual support did for us. And unfortunately, the divorce rate amongst men with prostate cancer is horrendous, as are the suicide rates for mental health, obviously. But we do see lots of relationships break down because of the lack of normal sexuality.
Yeah. And sex is just something that is still even today taboo to talk about, and so people just don't even talk about it, whether they don't want to or they don't want to admit that they have a problem. And yeah, the breakdown of relationships, and it happens on the female side too with
Yeah.
reproductive cancers and stuff. And yeah, it should definitely be more mainstream, and it's not here in the States either,
Yeah.
unfortunately.
My wife and I sat with a psychosexual therapist. She was a clinical nurse specialist with an interest in psychosexual therapy. And we sat with her for, I think, 4 sessions. And we talked about things that we had never talked about back then it was 38 years of marriage. And we actually literally spoke about things that we'd never talked about because it's something that we never talked about. But we actually had a very, very open conversation about what sex meant to us, what intimacy meant to us. And it was really good for our relationship, and it's enabled us to maintain a strong, loving, intimate sexual relationship.
Gosh, I love that. Mm. All right, Tony. So, where can people find you if people want to get in touch with you, if they want more information from you? What is the best way for people to contact you?
Yeah, Tackle Prostate Cancer is probably the best way. You'll find my details on Tackle Prostate Cancer's website. Its full name is the National Federation of Prostate Cancer Support Groups, so you can see why we call it Tackle Prostate Cancer, because that's a really long name. Yeah, so Tackle Prostate Cancer's website, you'll find me on there. And yeah, do feel for anybody who feels the need for some support peer to peer with someone who's living with stage 4 prostate cancer. I'm very open to have a conversation on the telephone, on Teams, on Zoom, or wherever. But yeah, feel free to contact me. I'm absolutely delighted to talk to anybody.
Okay, awesome. And then one final question. So, if you were to come across somebody, and I know you do all the time, who is just diagnosed with cancer or is in the midst of the overwhelm of these early stages of diagnosis, what is one piece of advice that you could give to them to just kind of help them get through that overwhelm of the early days?
Well, I think the most important thing I learned, and I did actually use the expression, the saying before, but this was the saying of the founder of Maggie's. She said, don't lose the joy of living through the fear of dying. And I think that would be what I would say to anybody newly diagnosed with cancer. And one of the lady specialists at the Maggie Centre said to me, just remember that you're living with cancer, not dying of cancer. And I think that's really important. You have to make the most of every single day. And I got that wrong for 18 months. But ever since that 18 months passed, I try to get joy out of every single day. Think about things that, really mean things to you, like your children or grandchildren, your family, and just try to get some joy out of every day. And don't lose the joy of living through the fear of dying.
Yeah, that is beautiful. I'm gonna put that on my wall. Don't lose the joy of living through the fear of dying.
That's it. Yeah.
All right. Well, Tony, thank you so much for your time today. This was such an important conversation, and I know people are going to get a lot out of it, and I really appreciate you taking the time to share all of that with me today.
It's a great pleasure. Thanks for asking me. It's been a delight. Thank you.
Of course. Have a great rest of your day.
Will do.
All right. Bye-bye.